Hello America, my name is Kevin Barber, and tonight I'm going to give my response to President Obama's speech regarding healthcare reform in America. Let's jump right into the changes to existing insurance companies. First, it's going to be illegal to deny coverage to any American. That increased risk for insurance companies, I believe, will amount to a rate increase for all insurance across the board. Second, he'll make it illegal to cancel coverage for any American. I believe that increased risk and increased mandate on insurance companies will amount to a rate increase across the board. Third, by mandate, he will remove all caps on coverage for insurance. Therefore, the new unlimited expenses for insurance companies will amount to a rate increase across the board. Fourth, he will limit out-of-pocket expenses for individuals and pass those expenses onto insurance companies, and that will amount to a rate increase across the board. Fifth, insurance companies will be required to cover more services at no cost to the consumer. Therefore, the insurance companies will have higher expenses, and they will pass those expenses on to the people paying for insurance with a rate increase across the board. Sixth, he will tax insurance companies for expensive policies. Expensive policies will now have a tax on top of them, and that tax will be passed on to the people that buy them, and those expensive policies will now be more expensive. Next, he made a special point that uninsured Americans will now have affordable choices. This will be made available through his insurance exchange. And I believe we'd already have this insurance exchange if it wasn't for the fact that there are mandates preventing competitive insurance across states and with a national plan. You know, why is it that 90% of residents of Alabama buy health insurance through one company, but they can't buy a plan from Texas or Georgia or Alaska? Why is it that Aetna and Coventry can't offer a nationwide plan? I believe that those flexibilities, those changes to healthcare in itself would bring free market competition and lower prices due to that. Next, it wasn't even mentioned that Aetna and Coventry have gone to the White House and brought the administration a plan to cover every single American with no pre-existing conditions. And these plans have never been discussed. They've never been debated. They've hardly made it into the media. I've had to dig just to find them. The new plan will require individuals to get health insurance. It will require employers to provide health insurance. I believe that requiring individuals to get health coverage is a debate into itself. By what authority does this power come from? Requiring employers to provide health coverage is going to only increase layoffs. It's only going to increase the burden on companies. While I think that having health coverage for all Americans is a great idea, I don't believe that they're taking the right path to get there. Next, I'd like to talk about the publicly sponsored insurance option. And by publicly sponsored, what that means is that the public will pay for it. Now, he set it up as a not-for-profit public option that will just simply be one of the many options on the insurance exchange. And less than 5% of Americans will sign up for it. It must be self-sufficient, and my question to that is, how will it be held accountable? In reality, I applaud the president for thinking of the deficit and spending so much time talking about the deficit and how there will be no addition to the deficit through this healthcare reform. The spending cuts if savings don't materialize, I think, was great. I just want to see how it's going to be implemented and held accountable. I also think that it's great that not $1 from the Medicare Trust will be used to pay for this plan. Now, requiring every American to buy health insurance is only going to go so far. If you simply don't have the money, then it's not going to work. So tax credits for the needy, I was waiting for that, and it came. Also, immediate coverage for the unemployed and the sick, that came as well. So immediate coverage for the unemployed and the sick, as well as tax credits for the needy, while not costing $1 in the deficit and paying for itself, I'm already concerned, and we haven't even talked about any of the details yet. Also, it'll cost $900 billion over 10 years. what she pointed out was less than the cost of the Iraq War and less than the cost of the Bush tax cuts. My question is how is spending $900 billion saving money? I think there's an easier way to save money, which is by not spending $900 billion. And by simply doing the math that less than 5% of Americans are going to sign up for this plan, that's 14.6 million Americans by the White House's own numbers. If you divide $900 billion over 10 years, that would be $90 billion a year, and then divide that by the number of Americans they expect to cover, then that's over $6,000 per year per person, not per household, but per person. Is anyone aware of any insurance coverage that costs $6,000 per year per person? How is this going to be competitive? How is it going to be paid for? I have lots of questions. The math is fuzzy. Next, the president talked about Medicare and how it's a huge problem, and our healthcare problem is our deficit problem. Nothing else even comes close. So the government that gave us Medicare is going to fix the entire healthcare system by giving us this new public option at a cost of $900 billion that less than 5% of Americans will sign up for, at a cost of more than $6,000 per person, and it won't raise the deficit by 1 penny. Not to mention immediate coverage for the sick and needy, and tax credits for those that can't afford to buy the newly mandated insurance. Last, I'd like to talk about the resume of the federal government in terms of providing services. The government that wants to give you this public option is the same one that has brought us the incredibly efficient and streamlined IRS. They've brought us the service level of the DMV. They've brought us the efficiency of the post office. And they've brought us the rapid response, amazingly well thought through response in Katrina. Oh, and I almost forgot to mention, what I find interesting is that the route to improve our healthcare system is to pass these mandates that will absolutely increase the cost of all healthcare insurance across the board, as well as spend $900 billion to cover less than 5% of the population at a net per person cost that is off the charts. And we should do that instead of considering the nationwide plans of insurance companies to cover every American and all pre-existing conditions. There's no debate on it at all. And also, we've not talked about the ideas of making all medical expenses tax deductible, eliminating federal regulations that discourage small businesses from providing coverage, giving doctors the freedom to collectively negotiate with insurance companies and drive down the cost of medical care, to make every American eligible for a health savings account, and removing the requirements that Americans have to obtain a high deductible insurance policy before opening a health savings account. We haven't talked about reducing doctors' legal fees in malpractice insurance by giving individuals access to negative outcome insurance programs, which would have cap limits in the event that a medical procedure that has a negative outcome. Malpractice insurance rates would fall through the floor, and individuals would still be protected. This would also help reduce excess medical treatments that are basically excess visits and unnecessary care that our doctors provide for fear of being sued. It doesn't discuss removing regulation that would prevent individuals from shopping for insurance across states. It doesn't talk about removing regulation that would prevent health insurance companies from offering a nationwide plan. Finally, it doesn't talk about what I think is the best idea of all, which is if government public options are the way forward, then why not test it at the state level? Why not run a state healthcare plan that's compatible with the 10th Amendment? Why not have a state healthcare plan that allows different states with different needs to do what they think is best for their citizens, learn from each other, and improve it within the testbed of American states? If it's successful, the rest of the nation would adopt it willingly. I think that we would learn from it much faster, and rather than put all of our eggs in the basket of the government that brought us the IRS, that brought us the DMV, that brought us, the post office, that brought us, the response to Katrina, ultimately, I simply look forward to continuing this debate. Let's debate whether government is the option. Let's debate whether government is the right option and whether they have any expertise or any history of being the cost cutter, the low-cost option that streamlines services and cuts red tape, or whether they are the red tape. Let's discuss the nationwide health plans offered by Aetna and Coventry. Let's discuss the various cost-cutting measures I proposed tonight and other measures proposed by other representatives, individuals, companies. I think we should all put it on the table, and this debate should continue for probably a while before we can settle on what's going to work. And for states that would like to take the lead and implement government care, I encourage that as well. Please visit unionofpatriots.com for individuals like myself and others, and please post a comment. Thanks.